to uses noticed some things in the apartment she was living in, started feeling poorly, etc. If you notice, there's on the left side the IgG antibodies, and I'm going to help you understand there's a big difference between IgG antibodies to pathogens. There's 4 pathogens in microbiology: bacteria, viruses, pathogenic fungi, and parasites, versus IgG antibody to a toxin, mercury, mycotoxins, etc. And the IgE on the right is related more to mast cell activation. When you have very elevated levels of IgE antibodies to mycotoxins, that points to a problem with an issue with mast cell activation that can get to mast cell activation. So, as you can see, this person has where you see the yellow, that's low, then moderate, moderately high, and high. The issue is, how much is okay? How much of mercury is okay in the human body? Well, actually none. You don't want any mercury, you don't want any arsenic, you don't want any lead, you don't want any glyphosate, et cetera, in the body. So in this case, she was positive for everything. Then I just want to put this in, and I know it's available in the chat, but if you look at the bottom and in the bottom, not all the way down, one above the last one, it's called, it's a mycotoxin called gliotoxin, and studies from Rutgers University School of Medicine showed that this is directly in 60% of cases related to MS, multiple sclerosis. If you have anyone with gliotoxin, please be careful. Do not give them glutathione, because glutathione increases the toxicity of gliotoxin, something a lot of people aren't aware of, but it's in the medical literature. It was first written about, I think, in 2009 or 2010. I'm very evidence-based. If the internet says, use this and it'll help your hair grow back, and won't be as white anymore like mine, that's great. I'm happy to hear that, but show me the evidence that it works. Now, here's another one. And what's a little different, I put this light blue column here because that's normal. So as you can see, this is a 28-year-old, and he thinks he had in his college dorm, he had mold. He thinks he did. Now he got married, they bought a house. He and his wife were not feeling well all the time. They left the house to go visit his or her parents for a long weekend, and they came back. They opened the door, and they could immediately tell the difference, that there was a certain odor in the house, and second, they felt great over at their parents' place, that they didn't feel well where they lived. Now, as you can see, they have a lot of IgG. IgG means toxicity to mycotoxins, and they have quite a lot. They're positive for all 12 mycotoxins. And then on the right side, it's IgE. It's not that bad, because the body's reacting more to the toxicity than anything else, and it's struggling with it because it's pretty severe. To let you know the rest of the story, as Paul Harvey said, they found a leak behind the refrigerator. They had one of these refrigerators like a lot of us have that spits out ice and cold water and things like that, and didn't realize it had not been hooked up correctly. And as a result, there was a drip in the back, and it created a pool of a small pool of water. And that small pool of water eventually turned into a toxic soup of mold. So that's that gives you an idea of what can happen. Now, I put this slide up because you can see this is what we would call mast cell activation syndrome. On the right side, you've got a lot of IgE antibodies. And normally, anything that that's IgE drives mast cells to release, histamine and heparin and various other things. However, when you're talking of a toxin and you have this kind of a positive reaction to a positive IgE, it's the mastocytes are going to release some pro-inflammatory cytokines. And these cytokines, IL-6, IL-17, IL-31, et cetera, are going to cause inflammation throughout the body. The other thing is mast cells are located close to the surface of the skin. They're located throughout the respiratory tree and parts of the digestive tract, and they're located at the entrance, all the different entrances to the brain. So they're also going to have brain issues. What does brain issue mean? It means literally that they're going to have issues with fatigue, sleep disturbance, short-term memory loss, anxiety, depression. It'll take them reading the same paragraph twice to understand it. They're going to be cognitively affected. So let me take you to this one, which is the opposite. This is where you have very little IgE antibody stimulation, but more of the IgG. And this person was a 47-year-old a male who interestingly felt great over the weekends. And then he'd go into work, and whenever he worked, he felt horrible. He just, I shouldn't say horrible, he just didn't feel well. Again, cognitive issues, problems, et cetera, et cetera. Well, why? Because, when I talked to him and I said, is there any water coming intrusion into your office at work? He says, oh, well, the window next to my desk, whenever there's been a rain the night before, that part under the window, that carpet part is wet. So obviously there's going to be anywhere where there's water intrusion, you're going to eventually have mold issues. And molds are like any vegetative thing. They reproduce by seeds. The seeds in this case for molds are mold spores, and the mold spores carry with them mycotoxins. Your hair is 100 microns thick. For those who have a few left, like me, 100 microns thick. The mold spores are 2 to 4 microns thick. So they go to the deepest parts of your respiratory tree, into your sinuses, as we learned last week, and also into the deepest part of the lungs. They go deep in the alveoli, they cross over into the blood, and then go wherever they want. So, and by the way, 100 microns for your hair, 2 to 4 microns for spores, 0.1 microns for mycotoxins, about the size of a virus. So you see that the mycotoxins can reach anywhere they want. Here's one more example. This is a lighter one. However, this woman who is a teacher, felt fine at home. Again, she felt affected at school. And a lot of the kids she taught were also, had problems and issues, etc. So, And so with that, having said that, she even mentioned that one of the people in the custodial staff of the school was on workman's comp leave because of the amount of mold that person had been cleaning up at the school. So although these are not enormously high levels, there are enough levels, they're high enough that the person felt ill. You don't need really, really high levels to feel sick. As an example, where do mycotoxins go first? I just told you that mold spores go into the lungs and sinuses, but where do mycotoxins go? They go to the brain. They cause demyelination in the brain, and not only in the brain, but in the peripheral nervous system, etc. Years ago, we published a study with a group of us published a study on how this causes acoustic neuromas in children in adolescence. In other words, it affects all the cranial nerves. And what happens to you if your vagus nerve is affected and it's demyelinated? You get gastroparesis, you get your gut and your enteric nervous system of the gut is affected because there's demyelination of that enteric nervous system. And that leads to SIBO and it leads to IBS and all kinds of other problems. Here is a young man. Well, he's 17 and he lives at home, and he was starting to feel, he'd come home from school and go to bed and sleep. He was a great athlete. He did really well in school with his grades, etc. And then his grades started dropping. Athletics were affected. His ability to perform in athletics was affected. And here you see a picture where he's affected by many mycotoxins. You don't need a high positive. He's 17. It's bad enough that he's affected so much. He had all kinds of testing. He had EBV, he had Lyme's, he had all this. The Lyme person treated him for Lyme for like 8 months. There was no response. What people don't understand is that there's cross-reactivity with testing. And I'm going to make a statement, but it's not a political one. But antibodies to toxins trump antibodies to pathogens, such as Lyme, which is a bacteria. So the reason he tested positive for Lyme is because he tested positive for IgG antibodies and IgE, but to a lower extent. So if you see, and it activates all the others. He was positive for EBV, CMV, HHSV6, etc. But it's a cross-reactivity. It lights up because this is an ELISA test, enzyme-linked immunoabsorbent assay, which is about 97% accurate. The others are not. They're usually immunofluorescent assays, etc. So they get, again, forgive me for the term, but they get trumped by the mycotoxins. This was a very interesting case. This is a 62-year-old woman who was feeling awful, and her husband was fine, but her husband went off to work every day. And she didn't know what was wrong with her. And by the way, this person is a clinician. And her practice started getting affected because she couldn't remember things well. And then on your right, you've got the IgE antibodies also starting to show up. Well, she had her home tested for mold and it was negative. So her husband bought a kit from, I think it was Lowe's or somewhere like that, and put it in his pickup truck one afternoon. The next morning he went out, it was totally covered with mold. So it wasn't in the house, it wasn't in her practice, it was in her vehicle, that she used every day to travel back and forth 45 minutes each way to her practice. And every time she turned on either the blower for heat or for air conditioning, she'd get all these mold spores coming at her with their mycotoxins. So this shows you that you've got to be a little bit of a
Detective.
kind of how would I call it, a Sherlock Holmes, to kind of get everything and ask the right questions. Now, here's another case of mast cell activation syndrome. This was a young girl. She's 28, married. Her husband works, he works out of the home. She works in the home. She's very active socially. She goes to the gym a lot, etc. She's a very active person. And then it started going downhill. Well, they did, to make a long story short, they did find mold in the home, but she'd break out in rashes every so often. And I have these rashes on pictures for other presentations. She'd break out on her neck, on her legs, thighs, back, arms, hands, everywhere. They would be migrating. I mean, it wasn't the same place each time. And as a result, this is what came to see me. She did this. She had her home fixed or remediated. And I want to mention this, if you're constantly exposed to the mold spores and the mycotoxins, there's no use in any kind of a treatment. But she had her home remediated, and then we started treatment. Sure enough, it took 3 months for the rashes to go away, and within 6 months, she was fine. Yeah. And
okay, I'm listening to the presentation, but yes.
I'm sorry?
Sorry about that, Dr. Campbell.
Oh, okay. Anyway, so I wanted to bring to you some, having said this about this person, mast cell activation is starting to show up in medical studies, in published medical studies. And there's a lot of different variations of what tests you should order. And right now it's still not well defined as far as how to diagnose it, what diagnostic tools to use, and what treatment tools to use. It's in process. I can tell you that there's 3 of us that are getting our papers published on mast cell activation syndrome. If and when they're accepted, I'll share it with everyone. But mast cell activation syndrome is something that affects a lot of young people, old people, all kinds, and a lot of docs are not aware of it. If you want any information on it, just email me. So now I want to take you to testing. This is a study that came out just in this past October. And it said that the variability of mycotoxin concentration in urine and its volume based on the daily intake demands urine sampling at different time points during the day, because you have to normalize the results with creatinine concentration. And as a result, the individual comparison of mycotoxins is very challenging because of age, gender, diet, muscle mass, etc. So, and this study, which is here by Karg et al., analytical validation of direct competitive ELISA for multiple mycotoxin detection in human serum. They say the ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. So where a lot of people use the urine test, but there's a lot of issues with that test. And this is why if you look up urine testing for mycotoxins on Google, halfway down the first page, there's something by the CDC that said this is not a validated test and you shouldn't use it for diagnostic purposes. Well, we know that the serum test is very accurate. It's been around for 30 years. And there's a lot of studies that have used it and continued right now with Tufts and Washington University School of Medicine. All right, so here's something that everybody that deals with patients with mold gets. They say, how do I find where the mold is? What do I do? How is that? What's the best way to find out? Well, this study published this in just this past year. They discuss how carefully you must test a home. Why? Because all you have to do to become a mold inspector is take a weekend course at a Holiday Inn Express, pass an exam, and get a certificate, and that's it. So, and it's not a very regulated issue, and there's people who have, and if you use 5 different mold inspectors, you'll get 5 different results and 5 different prices and be told 5 different things to do. So having said that, here's what this study says. And it goes on to say, is you can read it yourself. And then it goes on to say, in order to provide a secure identification and characterization of indoor mold exposure, directly contaminated building materials, swab samples and sampling, etc. So the issue is these people come in with air traps, do an air test and say, this is what you have. But that's only good for at that time. They don't check between walls. They don't check what the air ducts may have upstairs, downstairs, or throughout the house. They just use that and say, here's what came out in that test. Yeah, that's what came out in that test, but it doesn't mean that that's how the rest of the home is. And finally, they said that there's a lot of people that say, oh, you get mold out of because you eat grains and things. Well, it's still a global burden, but as they put it here, it's not going to affect people where, like in the industrialized countries, United States, Canada, Europe, etc., it's where this is tightly controlled. Here's another thing that I wanted to bring up about food and the issue of mold. So this group published a few years ago shows that if you read, there's a 2-year-old child with a body weight of 28.2 pounds would have to eat 38.8 ounces of oatmeal. That I'm talking about contaminated oatmeal, not that's smelly and looks bad, or 3.5 slices of moldy bread. And what would the adult have to do? Well, here's what the adult has to do. Oops, sorry. You'd have to eat 20 slices of moldy bread or a huge amount of oatmeal that no one's going to sit down and eat at one time, especially when it's rancid. So this kind of tells you when people say the mold is in food, no, it's not. It's not. Yes, there are studies that show this in Ivory Coast, in Ghana, in Ethiopia, and various countries, and also in rural parts of Western China. But they're not happening in this country or in other industrialized countries. So here's Fusarium. I get a lot of questions about Fusarium because it produces a mycotoxin known as vomitoxin. Okay. So the fusarium cause a lot of infections, the mold itself, eyes, keratitis, etc., nasal sinuses, systemic infections, but especially if you're immunocompromised, if you're on cancer therapy, if you have AIDS, if you're taking steroids, etc. For this, if you get an infection by the mold fusarium, voriconazole and liposomal amphotericin B treatment gives you the best results. And I have a physician who developed keratitis because his home was contaminated, blurred vision, et cetera, went to see his buddy, the ophthalmologist, et cetera, and now he's fine. He also moved out of the home, very importantly. So the issue of fusarium is it can produce a lot of different mycotoxins in large amounts. And since it's widespread in contaminated indoor environments, not in grains. So this is where you get colonization of the respiratory tree. And the other part is if you have any kind of a foreign object in you, indwelling catheter, artificial heart valve, joint replacement, etc., fusarium will grow on these. So you've got to be very vigilant for this. If you have a patient that's just continually deteriorating, think of fusarium, do the MyMichael blood test, serum blood test, and if vomitoxin shows up, you know it's fusarium. Now, again, the effect is very low in developed countries because it's highly controlled. The FDA watches over this stuff like a hawk. And down at the bottom, you can see this is a 2.5-year-old study that was published in the journal Toxin. Here's something very interesting. Oops, sorry about that. But this is a study on cancer that was found. This is in the journal Cell. It was published September, a few months back. And they found fungi in 35 different cancers. So they took 17,000 plus patients, tissue, blood, serum, 35 different types of cancer, none in urine. No, they didn't use urine. Fungi were found in individual tumor types and contributed to the carcinogenesis in esophageal, pancreatic, breast, lung, melanoma, ovary cancer, and bone cancers. So I think this is very interesting that now we're seeing that fungi can cause cancer. So here is itraconazole, which is what I use to treat my patients who have mold and mycotoxin issues. It's also known as Sporanox. It's been in clinical use for 35 years and has an established safety record. And so multiple phase, let me go back. Multiple phase 2 clinical trial investigating itraconazole for non-small cell lung cancer, prostate, basal cell. They showed increase in the progression-free and overall survival of these patients. Well, if 35 different cancers had fungi, you kill the fungi, I'm assuming that that's why it works. Now, retrospective studies with ovarian cancer, recurrent breast cancer, and these people were taking itraconazole, significant increases in overall survival. So, to me, that's pretty exciting to see this, the link between cancer and moles. Oh, I already gave you this. So if you want a copy of any of this, please let me know. That's my email, immunedoctor@gmail. If I use a 14-page questionnaire for every first patient visit, I'll be happy to share it with anyone. This is a study that was published almost a year ago. Molds, mycotoxins, the brain, the gut, and misconceptions. Misconceptions mainly because a lot of people use binders and things like that don't work. So I'll be happy to share all that. And I think that concludes my lecture, and I'll be happy to answer any questions at this time from you.
Wow, thank you, Dr. Campbell. What's that interesting structure behind you?
Oh, this is two different paintings by some guy, and he lent these to me, and I put them up just for probably take him down on probably Monday, tomorrow morning or the day after, probably on Thursday morning, I'll take him down. He wanted me to show his art.
Okay. All right. There was a question early on that I think you answered about glutathione and gliotoxin. Could you just sort of summarize that again?
Yeah. So if a patient has gliotoxin, tests positive for gliotoxin antibodies, either IgG or IgE, it doesn't matter. That means their immune system is fighting against gliotoxin. Don't use glutathione. Why? Because glutathione increases the toxicity of gliotoxin. The other question is this test covered by insurance? The lab is a fee-for-service lab. It doesn't accept any kind of insurance because it's a high complexity lab, and you'd have to go through, I mean, Blue Cross Blue Shield, all those, no, so they don't. The other question is, how long do you wait to recheck? You start treatment, you recheck at 6 months. The test is 12 different mycotoxins with IgE and IgG. That's a panel 24. It's $380. You're not going to get anything from eating blue cheese as far as mycotoxins, etc. You can eat some every day. That's not going to affect you. Actually, there's in another presentation I give, I actually show how studies have demonstrated that the gut helps detoxify mycotoxins versus through an oxidation process. How were the mycotoxins tested in the patient cancers? That's provided in the study itself. So here's the study. It was serum, blood, and tissue testing. And that's what they did for these 17,401 patients. The lab is MyMyco lab. Mycology is the study of molds. So they called it by the way, I'm the medical advisor. I'm not the owner. But it's MyMyco lab. Any other questions? So if you get a patient with melanoma, yeah, some people are going to refer them to their dermatologist. And then you can tell the dermatologist, I know how to treat this and get rid of the melanoma. Just give them some Sporanox and see how they react. It'll be fun.
I've been starting to do it, Dr. Campbell. A couple patients now. Let's see how they do with it.
Well, I have 2 patients with recurrent breast cancer, and they're both on Sporanox. And I did this with the agreement of the oncologist because he's tried his thing. He doesn't know what else to do. Except give more of the same. If you don't treat each specific mold or toxin, and let me help you the dose and all that. I see a lot of clinicians use things like that treat. Okay, there's two kinds of molds: single cell molds and multi-cell molds. The single cell molds are basically yeasts. Most famous yeast, obviously, being Candida. Then, and that's best treated with fluconazole or something similar. The multicellular molds, which are Aspergillus, Penicillium, Stachybotrys, etc., don't respond to fluconazole because fluconazole is for single cell. You've got to use something multicellular, and usually itraconazole is very safe. It's 100 milligrams twice a day. Okay, and what you do is you give that, and there's a set of supportive supplements that you should use. Let me give you an example: vitamin C. We as humans we do not make vitamin C, nor can we store it. So they've got it, but these mycotoxins cause a lot of oxidative stress. To combat that is with vitamin C. So if you go to the My Myco Lab website and at the top click on video, there's all my webinars, and included in there is a video, a webinar on treatment. Vestibular neuritis, yes, it does cause that. It also causes optic neuritis. So it causes all the neuritis, which is the inflammation of the nerve leading to the eyes, leading to the ears, et cetera, et cetera. So terbinafine is okay to use if you have some single cell mold issues. And if you've improved, it's because you got rid of some of the single cell, but it's not going to cure you. You need something stronger to get rid. You need not stronger, but just different to get rid of the multicellular molds. And usually I like itraconazole because has a good safety, etc. And also I like voriconazole as well. Binders do not work. So if you're big on binders, I can show you a slide that they don't work. And if you can show me one study, a single study on that binders work in humans, then I'll change my mind. I don't use Quicksilver. But this is obviously someone's own kind of formulation, but it's not the one I recommend, nor the one that I've used for 30 years in treating patients. So, and the vitamin D, the sauna has to be infrared. Okay, and you don't use itraconazole once a day; you use it twice a day. And if you can again show me that the medical evidence behind any kind of binders, that these do anything in humans. I'm not interested in sheep and rabbits and piglets and chickens. I want studies in humans. I'll reconsider, but I do not recommend you use any kind of binders. I get about 5 to 10 emails a day from people who've been on binders anywhere from 2 to 4 or 5 years, and they say they're still sick. So I just thought I'd share that with you.
What do you do for the people who herx?
In my patients, and I've seen over 15,000, the amount of herx I get is a handful a year, a handful. And usually what I tell them is to stick it through. And within a few days, it'll get better. And within a week, they're fine. And again, I've been doing this a long time. Look at the color of my hair.
Still in my lines now. So,
Again, if for treatment, I recommend you go to the My Medical Lab website and click on video. And there's a lot of my different webinars, but especially look at the one on treatment. Okay, POTS. There's actually a study showing how mycotoxins, molds and mycotoxins cause POTS. And I can share that study with you if you just shoot me an email. There's a lot of really good studies showing all kinds of things that mycotoxins do. Instead of going to Dr. Google and asking questions to Dr. Google, who may answer this or that or the other, the medical literature literally has thousands and sometimes tens of thousands of studies from any subject regarding molds and mycotoxins. So use medical and scientific evidence to diagnose and to treat, not what somebody says, an opinion on the internet or an anecdote on the internet. So yes, the POTS will completely, all these things resolve. Once you treat the patient, remember the third slide I showed you. Find the cause, remove the cause, repair the damage, and the patient is fine. They're cured. Not well, they're cured. Does mold cause autonomic dysfunction? If it demyelinates nerves, it demyelinates nerves both of the autonomic and non-autonomic nervous systems. So yes, as I described before in the earlier, what happens if you demyelinate the vagus nerve? What happens to the enteric nervous system if it's demyelinated? So yes, it does cause autonomic dysfunction. I get a lot of patients who have all kinds of heart rhythm issues. Same problem. Are there any cases of persistent hypertension with itraconazole? No, and it's not written anywhere in the medical literature. It's not, so no. As a matter of fact, I showed you a slide from a study that showed that it's a very safe medication. Is Hashimoto's connected? Yes. I gave a lecture not too long ago on the effects of mycotoxins on hormones, and in women in particular, it's Hashimoto's thyroiditis. So, but in men, it particularly lowers the testosterone, and in women in reproductive years, it completely changes the progesterone and estrogen balance. It causes problems in pregnancy. Mycotoxins cross the placenta, and it's found in breast milk. Do molds cause autoimmune diseases? Mold, mycotoxin antibodies, not mold, mycotoxin antibodies attach themselves to human tissue and trigger autoimmune disorders. This has been shown by studies at Rutgers, which they did on MS, multiple sclerosis, which is an autoimmune disorder. And I could go on and on about all the different autoimmune disorders that are caused by mycotoxins, that are triggered by mycotoxins: Sjogren's, rheumatoid arthritis, lupus, Addison's disease, etc. And the effects of mycotoxins on hormones is, I mean, it's at the molecular level, but still it does cause autoimmune disorders.
why do you think there's so much resistance to testing for the molds and even it's almost like there's a disbelief in the medical community and in the general population?
Just let me answer this one. myasthenia gravis, is that an autoimmune disorder? Yeah. Oh, yeah, falls into the same thing. I've asked several colleagues this, and they say every time they go on the internet, they say they see in Google so much BS about molds and mycotoxins that they don't want to deal with it because, my uncle, Ralph, lived in a moldy home and lost all his hair. And once he left, I gave him this special walnut oil and he put it on his scalp. And after 2 months, his hair grew back. And I have this available on my website for only $75 for a bottle. And your hair will grow back. So, etc. Having said that, you've got to go back to the medical literature. And these doctors, again, they're so tired of seeing the BS all over the internet. Like, for instance, about binders. There isn't a single study in all of medicine, all the 35 million studies published in PubMed, showing that binders have any effect in humans. But you put binders in Google and your whole screen lights up with hundreds of places to go to for binders. There's no evidence. And I can tell you, when I get these emails from people, and I'm making a website, and I'm going to put them on the website showing, these binders don't work. They didn't help me. They didn't help my husband and I. I tried them on my son. They didn't, et cetera, et cetera. But it's an automatic, it's a knee-jerk reaction by a lot of the people on the internet. Does it affect heart rate? What happens if you demyelinate a nerve that innervates the heart? It causes abnormal heart rhythms. Yes, so atrial fib. All kinds of rhythm issues in the heart are known to be caused by mycotoxins. And by the way, the lab gets serum from psychiatrists. Why? Because psychiatrists see patients with anxiety and depression. They give them an anti-anxiolytic medication for the anxiety or an antidepressant for the depression, and it doesn't work. Then they do the Medical Lab tests. They see these elevated antibodies. They treat them for mold and mycotoxins, and the depression and anxiety goes away. And the lab is getting more and more of these all the time from psychiatrists of all people.
What's a typical treatment length with the iatroconazole?
I'm sorry?
How long would you use the iatroconazole?
It's different for different patients. In general, in the textbook chapters of in medical textbook chapters and in studies, they say you should use it a minimum of a year. But I've seen that in 6 months. 6 months is what I do. Rare cases, I might use it a little longer. And these are in people who were exposed for a long time in a very moldy, toxic home environment. Do I ever see where there's no mold in the environment and they're just getting mycotoxins from the overgrowth of mold in the GI or respiratory tract? So where did it get to the respiratory tract from? Okay. It came from the environment. In the gut, no. And there's many studies that shows the gut is not the place to look for. Is bicalin effective? No. And I know that Cystis T works against aflatoxins. I congratulate you that you know. if you would share that in a published study, we'd appreciate that. Do they affect kidney function? Especially, yes, especially ochratoxin A and B. Does antifungal destroy the microbiome? No. On the contrary, it helps the microbiome. If you want to study, I published a study in the journal Autoimmune Diseases on the effects of the microbiome on autoimmunity, and I'll be happy to share that with you. So now, antifungal treatment helps the microbiome, not the other way around.
Okay, what about brain function? I know you've covered that before, but just kind of a quick summary of some of the remedies, when to use it and why.
Does chronic use of antifungal lead to resistance? No. Again, this is all in the medical literature. It's well described, but no, there's resistance to antibiotics, to bacteria, and that's from a particular mechanism that bacteria have, especially the walls of bacteria. But these are mycotoxins and molds. These are different than bacteria, so they react a different way. I'm sorry, Bill, you were saying something when this message showed up?
Yeah. So brain function, some of the remedies there, I use phosphatidylserine. Is that one of your go-tos?
Yeah.
Or
So there's been a number of studies that show what do you do about demyelination in the brain and other peripheral demyelination, brain demyelination, et cetera, that cause all these neuritis and other problems. Phosphatidylserine has been shown to effectively help remyelinate, and this I'm talking about double-blind, placebo-controlled, randomized studies using phosphatidylserine. Every once in a while, I'll get the question, why not choline? And I'll tell the person, well, did you look up in the medical literature, choline, or phosphatidylserine? No, I just read it on the internet. So go look it up in the medical literature. Is Sporanox elevated blood pressure? No, has nothing to do with blood pressure. It will not elevate it. Some of the other things, we know that, for example, small doses of melatonin help the brain detoxify. It helps also in any kind of a brain injury, TBI, if you've got a TBI patient, or if you've got a person whose brain has been affected by toxins, not only necessarily mycotoxins, but say lead or mercury or something. Melatonin, 3 milligrams, 4 milligrams helps get rid of that toxicity. And of course, it'll help the patient sleep. The other part that you have to deal with the brain is you've got to give the body magnesium. We are probably all deficient in magnesium. Remember that when our great-great-grandparents, all the way back to Adam and Eve, they would drink water from wells, and in wells, there's all kinds of minerals from the earth. We drink water out of plastic bottles and things, and we filter it if we don't use it from plastic bottles, which removes all those minerals. So one of the principal minerals, this is in the case of magnesium, is involved in more than 350 enzymatic processes in the body. And we all should be taking some magnesium, especially if you're ill or affected by a toxin, such as mycotoxins, and it really helps people. Now, the problem with magnesium is that if you take a magnesium, it peaks in your blood in 2 hours, and in another 2 hours, your kidneys filter it out. So you've got to take it throughout the day many times. However, I get it from a company. It's called, and the product is called MAG SRT for sustained release treatment. The company's name is Jigsaw Health, and it's great. You give one in the morning, one in the evening. It keeps that level of magnesium for the patient at a certain level, which is great, which they need. The other part that I give is I use curcumin because mycotoxins cause a lot of ROS, reactive oxygen species, which means a lot of inflammation. And I showed you how IgE antibodies cause mastocytes to release pro-inflammatory cytokines. And again, those pro-inflammatory cytokines are going to cause all kinds of body inflammation. So I use curcumin, a very simple supplement to reduce the inflammation, to help slowly reduce that inflammation throughout for that patient. And there's several others, and it's all in that in the webinar I gave on treatment. And it's a paradigm because it's not the same treatment. It's not a protocol. Protocol is one size fits all. Protocol means if it's a 22-year-old woman, you give the same as a 55-year-old male who weighs twice as much. That's protocol. No, doesn't work that way in humans. You've got to use a paradigm. You've got to, what happens if the patient has more gut issues or the patient has more brain issues, etc. You've got to adjust it. And again, it's in the webinar that I gave on treatment. Are there any more questions? How do you order the test? You go to the My Medical Lab website and you register. And it's a test. It's called a mycotoxin analysis.
Okay, so I can personally attest that Dr. Campbell's website is loaded with information. I mean, there's videos there. You can start at the beginning and become an expert by the time you're done with getting through all the videos. So, and they're not that long. They're action packed and very succinct. So, so I'd highly recommend it. It's you know, he simplifies everything for those of us that are cerebrally challenged. You know, at the point of time where our hair is this color. So, anybody else have any kind of questions, information?
There's a question about
Wobenzyme.
Wobenzyme on empty stomach.
Mm-hmm.
I have not read anything that does anything to molds or mycotoxins. Again, I rely on medical and scientific evidence for everything on my patients. Patients put one of their most precious what they have is very precious, their health. They put that into our hands. And it's our duty to make sure that what we recommend, either as diagnostic or methods or treatment, is something that will help them, not that it helped these people, so it's going to help those people. No. So this is why it's so important to have evidence, medical and scientific evidence, to show that these things actually work. Anyway, that's the last question, I think.
We're getting kudos and thank yous and great lecture.
Thank you.
From the crowd, as always. We thank you, you know, always, you know, supporting us and being there for us. And I can't wait to see you again in Florida.
Yep.
Like I said, they got me doing track shoe work. They gave me anybody, Dr. Campbell and I will be at the Age Management Medical Group. It's April 24th, or is it? No, 27th to the 30th. Last weekend in April.
By the way, I've published well over 100 studies in medical journals, as well as in chapters and medical books. run across anything with my name, don't pay PubMed fees or anything like that, shoot me an email, I'll send it to you for free.
All right, can't beat that.
Mm.
Okay, so, okay, anybody else have any other comments or questions? John, you usually have something for us. Dr.
No,
Burgess?
yeah, always a great lecture and very important information. We all need to get off our butts and start moving on this. It's important.
So,
There's a question about any pet studies. Yes, actually, veterinarians have more training on this than either DOs or MDs. And so I get referrals from vets because people take their pet to the veterinarian and veterinarian says, your pet, your dog, cat, whatever, parrot is affected by mycotoxins. Go see Campbell because you've got it too if your pet has it. So it's always interesting when I get a referral from a veterinarian.
I have a simple question, and that may deal with allergies to different animals. Some of my patients allergic to cats, deathly allergic to cats, not allergic to dogs, but some people are allergic to dogs and some are allergic to horses. Is there a breakdown of the difference between cats, dogs, horses, animals, and mold?
Yeah, that type of allergy is the classical IgE reaction. And that's to a particular protein found on their dander. So what they're reacting to, say they react to horses, but nothing else, or just to dogs, but nothing else, or just to cats, but not the dog. That's the protein on that dander. That's what they're reacting to. And again, that's an H1, H2 blocker kind of an issue, and avoidance, obviously.
Thank you.
Okay.
okay,
Mycotoxins in dog feed. If you mean commercial dog feed, such as is found in these bags, or the ones that are found in cans, I'm a woefully inadequate person to ask that for, because I just look at, I don't look at that part, but your veterinarian would be a source of information for that. And I'm sorry, I don't know about pets, because they're a very important part of a lot of people's lives.
Dr. Campbell? No,
Mhm.
I had a quick question regarding infrared saunas. Can those, or are those could those be a part of your treatment modalities from the aspect of detoxing, or is that even relevant?
I didn't quite hear that your question well. You want to put it in the chat? It might come out easier there.
Okay, I put it in, but I don't know if it went through. I'll try it again.
Okay.
I think his question was, does infrared sauna play a part of your protocol?
I don't have a protocol. I have a paradigm. So, I mean, I'm going to treat a male having problems with testosterone from mycotoxins vastly different than a female who's having Hashimoto's thyroiditis from mycotoxins. So that's why there's no paradigm, no protocol. Is infrared lamp helpful? I don't know. I know that infrared sauna is helpful, and you've got to go real low and real slow before, and very slowly build it up. Don't go in there and sit for 30 or 40 minutes at a time right off the bat, because it'll make you sick. But the lamp, I don't know that. I've not read that anywhere. So I'm sorry, I can't answer that.
Okay, any summary for us, Dr. Campbell?
Yeah, this is a very complex, very highly complex subject. I mean, we know now that 2/3, 3/4 of autism, behavioral issues, learning disabilities, et cetera, are caused by mycotoxins. We know that in the elderly, the latest studies show that 5 to 10% of Lou Gehrig's disease, ALS, amyotrophic lateral sclerosis, is caused by genetic components. 5 to 10%. The rest is considered to be caused by mycotoxins. And I mentioned already MS. We know that 35% from autopsy studies done of patients who died with Alzheimer's had mycotoxins in their brain. In the case of Parkinson's, studies have shown that in patients who died who had Parkinson's, every single part of their brain, including the cerebrospinal fluid, had fungi in it, molds. So we know that it affects anything from very young to very old. We know in the brain of the very young and the very up to the very through the very old. We also know that it has a tremendous effect on hormones. We know that it triggers autoimmune disorders. I have pictures of people with psoriasis before and after in my webinars. I have patients with rheumatoid arthritis before and after, and the test results showing how, and tell this to a rheumatologist and, he'll have a connection. How do you, here's a person, and by the way, one of these people was the mother of a pretty well-known doctor that I know William probably knows, because William kind of goes to the same conferences that I go. And he's one of the speakers there. And this was a picture, and his mom had psoriasis. She lived in a moldy home. She moved out, did the test, had the treatment, and then her psoriasis went away. Tell that to a rheumatologist. Or about the patient that had rheumatoid arthritis, and I show the pictures of his hands, fingers, and then they get out of the mold, get treated, and their rheumatoid arthritis is gone. With before and after pictures and before and after test results. So this is, there are several publications that have said this is really a public health issue, because it affects all parts of society, all economic levels and social levels of society. So, I mean, I have patients that live in trailers. I have patients who live in palaces in Hollywood, but they're all equally sick. And so it's really a public health issue. And I think that if you have somebody with Lyme, there's a lot of confusion in Lyme. People give treatment for Lyme for a year or 2 years, intravenous, et cetera. Can you imagine what happens to the microbiome of that patient? And they still are not well. Well, it's a cross reactivity with mycotoxins, and that's been shown in studies as well. So if you've got a patient with Lyme that doesn't get well, it's because they don't have Lyme, they have mycotoxins. Again, the toxins trump the pathogens. So there's a lot of these issues, same with Babesia, ehrlichiosis, Bartonella, and so on and so forth. This is not only for Lyme. So if you have a chance to review some of those webinars, because I discussed all these issues in those webinars. And the key is doing the test. You don't need a lot of other stuff. Doing the itraconazole, giving the right set of supplements depending on the patient's condition and complaints. Use the questionnaire to help you as they go along, and you'll see the numbers on the questionnaire dropping, because I have them answer they're put on there the severity of their symptoms on a 0 to 10. They start with 10, then they go to 8, then they go to 6 and 4 and 2 and 0. So you can actually follow them, and you can use that as in your charting. And again, I've done this for a heck of a long time. So anyway, I
There's
hope
a
this
question.
helps some of you.
There's a question about electromagnetic frequencies and mold growth.
EMF, yes.
Yeah.
The study was by Dr. Tamara Tuman and several other co-authors. I know her well. She's a great doctor, and their patients with mold issues and mycotoxin issues are very affected by EMF. And she sent me this study, I think, about 6 months ago. And it also mentions POTS and breast implants. So yes, EMF do have a role. I mean, they do affect these patients.
Do you have any experience with, sort of post these like hurricane you had in Florida last, fall, and residual or follow up with mold exposures? After a lot of the buildings are damaged, a lot of them have to be demolished and rebuilt. Is that something that's kind of on your radar at all?
Yes, I always look out for that. And there's a recent paper that came out last month in December on long COVID. And they treated patients with long COVID with itraconazole, and they got well. The theory being that people during COVID stayed home more. They didn't go to movies. They didn't go to shopping centers. They didn't go to restaurants. They stayed home. And the home may have been molding, and so they were more likely exposed to more mold and mycotoxins, and therefore this is part of long COVID. So now there are studies going on about long COVID and mycotoxins. So I thought that was kind of interesting. I should have added into the slides.
Okay, well, okay, great. Okay, anybody else have any other comments or questions? Dr. Campbell is informative and interesting as always. And we hope you'll come back sometime, and don't be a stranger. And it's mymycolab.com for the testing, and also his website. The videos there are, they'll cover everything from A to Z. Again, they're half hour to an hour at most, I think. Very clear and very concise, and the slides are very succinct. You can get up to speed on this fairly quickly. So I know it's something that we weren't taught way back when, in the dark ages, when we were going through training and all. So it's another one of these sort of new environmental things that we're dealing with a lot. So anybody else?
If any of you have any questions about patients, et cetera, if you want my help, recommendations, et cetera, you have my email. I've taught many clinicians, and now they're off on their own. They've grown, their practice has grown tremendously due to this. And they're, I want to teach others what I know so that you don't have to go through and learn it. I can show you how to do it. So any questions, I'll be happy to help.
I think that's what I was trying to say. So, okay. So next week we have our own Steve Hartman is going to discuss the caveman paleo diet.
I like to call it the ancestral diet.
Ancestral diet. Okay. And he's doing some research, some interesting research on that. Again, kudos again from the audience here for you, Dr. Campbell. And just a reminder, let your, let your colleagues know, let them, spread the word. If you need flyers or mailers or something, let me know. We'll get you something together. We have Dr. Peter McCullough coming February 21st. He will be here at a regular time, regular station. So next week we have Dr. Hartman, or PA Hartman. Sorry, I keep demoting you. So, and John, any last words?
Everything excellent.
Thank you so much for helping.
Okay, thank you
for having
all.
me. Wonderful.
Thank you, Dr.
wonderful.
Campbell. Thank you, everybody. We'll have the video up, as soon as we can. We've been pretty quick about some of them, and it's aosrd.org/webinars, aosrd.org/webinars. And that's where all the videos are from all of our conference, or all our webinars. And our conferences are on there also under conferences. And that's about it. That's what. Okay, we'll see you again next week, same time, same station.
Thank you.
We'll see you then. If you have any questions or comments or issues, let me know. And you still have Dr. Campbell's email address up there. Please to support all of our friends. So we'll say goodnight, and we'll see you again next week.
And everybody.
Good night, everybody.
Hey, thank you.
Oh, yeah, they're back from long term.
In spices, it almost